Thanks for joining us for health news you can use. Each week, we'll be taking an in-depth look at one of the biggest health stories or newest developments in the Kansas City area and what it means for you and your family at home. I'm Lindsay Stish. This week, we're talking about the latest developments in the fight against COVID-19 and what you need to know as we head into November. I'm here today with Dr. Sarah Boyd, an infectious disease physician on St. Luke's COVID response team. Thank you so much for joining us.
Thanks for having me.
Well, right now, new cases are climbing in all but 5 states, totaling more than 8.6 million cases and 225,000 deaths since the pandemic began. That's according to Johns Hopkins University. As the coronavirus pandemic continues, we're constantly getting new information on the virus, treatment, and how to stay safe. Most recently, we're learning more about what's considered close contact, who's at highest risk. We'll also be talking about how to stay safe when voting this election and with Thanksgiving coming up. Starting with the updated CDC guidelines, Dr. Boyd, tell us about the changes to what's now considered close contact to someone who has COVID.
So CDC guidelines always talked about being within 6 feet of the person with COVID, as well as 15 minutes. However, they recently updated it that 15 minutes is really cumulative over a 24-hour period instead of needing to be 15 minutes or longer in one sitting.
And the CDC guidelines have changed several times throughout this pandemic, whether it be on close contact, masking, or other areas. Talk about why that is and how we should take in that information.
Well, guidance does change, but I think we need everyone to remember that this is a new disease. And so there are new studies coming out all of the time. There's new guidance documents that are being adjusted as we look at those studies and figure out how to incorporate them into our daily lives. And I do think that we'll continue to see some changes moving forward, just as new information comes across and CDC is able to pull those studies together and make better recommendations for us.
Right. And I understand this stemmed from a recent case study. Tell me a little bit about that and what was found.
So it really was looking at a group of prisoners that had transferred into a new facility. Part of that prison's intake process was to test the prisoners for COVID, and they were all found to be positive. There was a prison guard that subsequently developed COVID after helping care for that group of prisoners. And because of the cameras in the prison setting, they were able to really look at the time that guard spent with the individual prisoners. And while he never had one contact that was more than 15 minutes, he did have multiple contacts throughout the day that totaled more than 15 minutes. They felt pretty confident he had no other sources for COVID exposure and that was likely where he acquired the disease.
So this is a fairly big change. What does this mean for what we should be doing in our day-to-day lives?
I think it's really just being more aware. Kind of all along, I've always felt like if you had really close contact, say maybe someone coughed directly on you, that obviously felt like a higher risk situation than maybe passing somebody just briefly in a grocery store aisle. So I think we've thought about it that way. It's really just a new way for the contact tracing definition for who they're going to really reach out and let know that you might have been exposed. And I think it probably doesn't change too much what we do, but I think we should all still just be really aware of our surroundings, our distancing from others, especially at times we might not be able to have a mask on, like meals or if you're taking a drink of water, that kind of thing.
Well, this weekend is Halloween. What's your recommendation for parents this year? Is it safe to go trick-or-treating?
Yeah, so I think, again, that kind of is an individual choice. It might depend on how high risk the individuals are in the household or the child. I think there are safer ways to trick or treat, whether that's establishing a new tradition that, maybe you buy your own candy and trick or treat and watch a movie, or perhaps it's in your neighborhood with individually wrapped treat bags or, some of the socially distanced trunk or treats where it's outdoors and you can kind of move space to space. I would encourage sort of large gatherings to avoid those, large parties, things that we might have done last year. Probably need to be thinking about twice for this year.
And on that note, Election Day is just around the corner, which can mean standing in long lines, as well as Thanksgiving later this month. As we continue to see an uptick in cases here locally, what's your biggest concern?
I think my biggest concern is just that people continue to really be aware of the need to mask, the need for that social distancing. And as we head into a season where we tend to move indoors because of weather and we tend to gather together because of holidays or events, I think all of those things weigh a little bit on my concern of what the next few weeks look like.
And we hear some people expressing concerns about the safety of the first approved vaccine. What would you say to people who have concerns?
Well, I think it's valid to have concerns. Certainly, there's a lot of information coming out about vaccines and the timing of the vaccine approvals. As we move into that time where that safety data is coming out, I do think it will make the news. People will see a lot of discussion between scientific experts about the data and what it means. And then as we move into where that actually might be available, obviously there's going to be discussions with your own medical provider about if it's right for you.
So can we expect more treatments to be FDA approved soon?
I anticipate that we will see some treatment, or at least some further treatment guidelines coming out as we get new information. Certainly, as we have all of these new medications, often patients get more than one. There's been a study looking at steroids and Decadron or dexamethasone as a treatment that did reduce mortality. So often patients are getting multiple treatments based on what their provider feels like they need at that point in time.
Lastly, what's your message or final piece of advice for people as we head into the next few months?
I would just encourage the public over the next few weeks as these major events happen to wear your mask, be aware of your surroundings, and try to keep that six foot distance. Wash your hands or use hand sanitizer frequently, and really think about how you can maybe make small changes to your daily routine that really make a big difference for us on the healthcare side.
Well, thank you so much again, Dr. Boyd, for joining us. If you'd like to find out more about COVID-19, including how to get tested and more, visit stlukeskc.org/COVID-19. Next week, we'll be talking to St. Luke's psychotherapist Monty Miller about how to handle Election Day stress. If you have any questions for him, you can send us a direct message to our main Facebook page. That's at St. Luke's KC. You can also stay up to date with all the latest developments on the COVID pandemic and other St. Luke's news at stlukeskc.org/news.